As we age, our bodies undergo numerous physiological and neurological changes that can significantly impact our ability to maintain balance. One of the most noticeable and potentially dangerous consequences of aging is an increased tendency to stumble, feel unsteady on our feet, or even experience unexpected falls. These issues are not just minor inconveniences. They can lead to serious injuries and a decline in overall mobility. But why does this happen? What specific changes occur in the body that make staying upright more difficult? More importantly, what can be done to counteract these effects and preserve stability as we age? Aging affects multiple systems in the body that are responsible for balance, including the vestibular system in the inner ear, which gradually loses sensitivity, the musculoskeletal system, which weakens over time, and the central nervous system, which becomes less efficient at processing sensory information. Additionally, factors such as vision impairments, joint stiffness, vitamin deficiencies, and medication side effects can all contribute to balance issues in older adults. While these changes are natural, they are not entirely unavoidable. With the right interventions, such as targeted exercise routines, dietary modifications, and medical consultations, older individuals can significantly reduce their risk of falls and maintain their independence. In today's discussion, we will explore the 13 most common reasons why balance declines after 60, breaking down how each factor contributes to instability. Stick around until the end, as reason number 7 is particularly dangerous and often overlooked. Whether you or a loved one are experiencing balance challenges, understanding these causes is the first step toward prevention and improved well-being. 1. Muscle weakness and loss, sarcopenia. One of the most noticeable changes with aging is a gradual decline in muscle mass and strength, a condition known as sarcopenia. This process begins as early as our 30s, but becomes more pronounced after the age of 50, particularly if we do not engage in regular strength-building exercises. The muscles that are most affected include those in the legs and core, which play a crucial role in balance and posture. Weaker muscles make it harder to stabilize the body, recover from minor stumbles, or generate the strength needed for quick corrective movements. Without adequate muscle maintenance, older adults may experience difficulty in walking, rising from a seated position, or even standing for long periods. 2. Joint stiffness and reduced flexibility. As we get older, our joints naturally become less flexible due to the gradual deterioration of cartilage, ligaments, and connective tissues. Additionally, many individuals reduce their level of physical activity with age, leading to further stiffness. Key joints such as the ankles, knees, and hips are particularly affected, making movements more restricted and less fluid. This stiffness limits the body's ability to make the rapid, small adjustments needed to maintain balance, increasing the likelihood of falls, especially when navigating uneven surfaces or changing directions suddenly. 3. Inner ear vestibular problems. The inner ear houses the vestibular system, which plays a critical role in balance by providing the brain with information about head position and motion. Over time, the cells in this system can deteriorate, reducing their ability to send accurate signals to the brain. As a result, many older adults experience dizziness, vertigo, or a general sensation of unsteadiness, particularly when getting up quickly or moving their head in different directions. These vestibular changes make everyday activities, such as walking or climbing stairs, more challenging and increase the risk of disorientation. 4. Decreased proprioception, body awareness in space. Proprioception refers to the body's ability to sense its position and movement in space, relying on specialized receptors in muscles, tendons, and joints. With age, these receptors become less sensitive, making it harder for the brain to accurately detect limb positioning and movement. This decline in sensory input can result in difficulty maintaining coordination, walking in a straight line, or responding quickly to changes in terrain. People with reduced proprioception often struggle with activities like navigating stairs, stepping onto curbs, or walking on uneven surfaces, increasing their risk of falls. 5. Vision changes and their impact on balance. Our visual system plays an essential role in balance by helping us orient ourselves and detect potential obstacles. However, age-related eye conditions such as cataracts, glaucoma, macular degeneration, or simply a decline in visual acuity can impair depth perception and peripheral vision. This makes it harder to judge distances, recognize obstacles, or adjust to low-light environments, such as dimly lit rooms or nighttime walking. Impaired vision forces the body to rely more heavily on other senses for balance, which may already be weakened due to aging. 6. Vitamin B12 deficiency and its effects on nerve function. Vitamin B12 is vital for maintaining a healthy nervous system and producing red blood cells that carry oxygen throughout the body. As people age, their ability to absorb B12 from food diminishes, increasing the risk of deficiency. A lack of B12 can cause nerve damage, leading to symptoms such as numbness, tingling in the hands and feet, and difficulty walking due to impaired coordination. Additionally, B12 deficiency can result in cognitive issues like memory problems and mental fog, which can further impact stability and balance. Older adults are at a higher risk due to dietary changes, medical conditions, such as atrophic gastritis, and certain medications that interfere with absorption. To prevent complications, it is crucial to monitor B12 levels and incorporate B12-rich foods, such as meat, fish, eggs, and dairy, or consider supplements under medical supervision. 7. Medication side effects and drug interactions. Many older adults take multiple medications to manage various health conditions, but some drugs can negatively affect balance and coordination. Medications such as blood pressure regulators, antidepressants, sedatives, and sleep aids can cause dizziness, drowsiness, or sudden drops in blood pressure, increasing the risk of falls. The effects can be further complicated when multiple medications interact with each other, or when the body becomes more sensitive to drug side effects with age. Regularly reviewing prescriptions with healthcare providers can help identify potential risks and adjust dosages or alternative medications as needed. However, stopping or changing medication without medical advice should always be avoided. 8. Chronic health conditions that affect balance. Many age-related health conditions can significantly impact balance, either by directly interfering with the body's stability mechanisms or by limiting movement. For example, diabetes can lead to peripheral neuropathy, a condition that damages the nerves in the feet and legs, reducing sensation and making it harder to detect changes in terrain. Parkinson's disease affects the nervous system, causing tremors, muscle rigidity, and slowed movement, all of which make maintaining balance difficult. Stroke survivors often experience weakness or paralysis on one side of the body, impairing coordination and making it harder to stay upright. Even conditions that do not directly affect balance, such as arthritis, can cause pain and stiffness in the joints, limiting mobility and making it harder to make quick postural adjustments when needed. 9. Dehydration and its impact on stability. Older adults are at a higher risk of dehydration due to a reduced sense of thirst, changes in kidney function, and the use of certain medications such as diuretics. Dehydration can lead to a drop in blood volume, causing a sudden decrease in blood pressure, which may result in dizziness, lightheadedness, or fainting, especially when standing up quickly, a condition known as orthostatic hypotension. This can dramatically increase the likelihood of falling. Additionally, dehydration can contribute to muscle cramps, fatigue, and confusion, all of which make it more difficult to move steadily and react appropriately to changes in balance. To prevent these effects, older adults should drink water consistently throughout the day, even when they do not feel thirsty, and consume water-rich foods like fruits and vegetables. 10. Fear of falling and its counterproductive effects. Ironically, the fear of falling can actually increase the risk of falls. When people become overly cautious, they often move more rigidly and hesitantly, rather than with the fluid, natural motions needed for good balance. This heightened anxiety can cause unnecessary tension in the muscles, making it harder to respond effectively to shifts in posture or balance disruptions. Additionally, individuals who fear falling may begin to limit their activity levels, leading to further muscle weakness, joint stiffness, and reduced confidence in their ability to move safely. Over time, this avoidance behavior creates a vicious cycle, where decreased movement contributes to worsening balance problems, making falls even more likely. 11. Reduced foot sensitivity and its effect on stability. The soles of our feet are packed with sensory nerve endings that help detect changes in surface texture, pressure, and positioning. This sensory feedback is crucial for making tiny, automatic adjustments that keep us stable while walking or standing. However, with aging, this sensitivity gradually declines, particularly in individuals with diabetes or neuropathy, making it more difficult to feel the ground beneath them. This is similar to trying to balance on an uneven surface while wearing thick socks. The brain doesn't receive enough precise information about the terrain, making stability more challenging. This loss of sensation can also delay reaction times when adjusting to sudden shifts in weight, increasing the risk of stumbling or misstepping. 12. Postural changes and their effect on balance. Over time, age-related changes in posture can subtly shift a person's center of gravity, making balance more difficult. Many older adults develop a more stooped stance, characterized by rounded shoulders and a forward head position. These changes often result from muscle weakness, spinal degeneration, and decreased flexibility, gradually altering the body's natural alignment. When posture is not properly aligned, even simple movements like standing up, turning, or walking require extra effort to maintain stability. This shift in weight distribution makes older adults more susceptible to falling, particularly when they encounter uneven surfaces or need to change directions quickly. 13. Cognitive decline and its impact on balance. The brain plays a critical role in balance by integrating sensory input from the eyes, ears, muscles, and joints to maintain stability. However, age-related cognitive decline, even in mild forms, can slow down the brain's ability to process and react to balance-related information. This can make it harder to adapt to sudden movements or environmental changes, such as avoiding obstacles or shifting weight on an uneven surface. The effect is especially pronounced when performing dual-task activities, such as walking while talking, carrying groceries, or navigating a crowded space. Older adults experiencing cognitive decline may struggle with spatial awareness, reaction times, and multitasking, all of which can make falls more likely. How to improve or recover your balance as you age. As we grow older, maintaining balance becomes increasingly important to prevent falls and maintain independence. Fortunately, there are many ways to improve or even regain your stability through targeted exercises, lifestyle adjustments, and environmental modifications. Let's explore these strategies in detail. 1. Strengthening your muscles to enhance stability. One of the primary reasons balance deteriorates with age is the loss of muscle strength, particularly in the legs, core, and back, muscle groups that play a crucial role in stabilizing movement. Regular exercise, especially strength training, can significantly slow or even reverse age-related muscle loss, a process known as sarcopenia. You don't need to engage in intense weightlifting to see benefits. Even simple exercises using light dumbbells, resistance bands, or bodyweight movements can help restore muscle function. Prioritize exercises like squats, lunges, and seated-to-stand movements to strengthen your lower body, as well as core workouts like planks and seated leg lifts. These exercises help build the strength needed for better posture, coordination, and overall stability. 2. Addressing joint stiffness through movement. Stiff joints can make it difficult to adjust your position quickly, increasing the risk of losing balance. Over time, cartilage naturally wears down, and inactivity can further restrict joint flexibility. To counteract this, regular movement is key. Incorporate gentle stretching exercises, range of motion drills, and low-impact activities such as yoga or Tai Chi. These not only keep joints flexible but also enhance proprioception, the body's ability to sense movement and positioning. Tai Chi, in particular, has been widely recognized for its ability to improve balance and coordination in older adults. 3. Compensating for inner ear changes with balance exercises. The inner ear houses the vestibular system, which plays a crucial role in detecting motion and spatial orientation. As we age, the tiny sensory cells responsible for this function gradually deteriorate, leading to dizziness or a feeling of unsteadiness. Although we can't completely stop this process, we can train the brain to compensate. Performing simple balance exercises regularly can help. Try standing on one foot while brushing your teeth, walking heel to toe in a straight line as if on a tightrope, or practicing movements on an unstable surface like a foam pad. Walking barefoot on different textures, such as grass, carpet, or tile, can also stimulate nerve endings in the feet and improve body awareness. 4. Preserving vision to maintain balance. Our eyesight plays a crucial role in helping us navigate our surroundings, judge distances, and detect obstacles. Age-related vision problems such as cataracts, glaucoma, and macular degeneration can significantly impact balance. To maintain visual clarity, schedule regular eye exams to ensure your prescription is up to date. Consider having separate glasses for indoor and outdoor use if necessary. Improve home lighting, especially on staircases, hallways, and bathrooms, to enhance visibility and reduce the risk of missteps. 5. Managing medication side effects that affect balance. Certain medications, including blood pressure drugs, sedatives, and antidepressants, can cause dizziness, drowsiness, or sudden drops in blood pressure, leading to an increased fall risk. If you've noticed balance issues after starting or changing a medication, speak with your doctor. They may be able to adjust your dosage or switch you to a different medication with fewer side effects. However, never stop taking prescribed medication without consulting a healthcare professional first. 6. Controlling chronic health conditions that impact stability. Medical conditions like diabetes, arthritis, or neurological disorders can have a direct effect on balance. For example, diabetes can lead to nerve damage, peripheral neuropathy, reducing sensation in the feet and making it harder to detect shifts in terrain. Keeping blood sugar levels stable can help prevent further nerve damage. Neurological conditions such as Parkinson's disease or stroke can impair motor function, making balance more difficult. Working with a physical therapist can be beneficial in these cases. Following your doctor's advice, taking medications as prescribed, and making necessary lifestyle adjustments can greatly improve balance and overall health. 7. Staying hydrated to avoid dizziness and weakness. Dehydration can cause dizziness, lightheadedness, and muscle fatigue, factors that contribute to poor balance. Since the body's ability to retain water decreases with age, it's important to drink enough fluids throughout the day. A good strategy is to keep a water bottle nearby and set reminders to drink regularly, especially if you tend to forget. 8. Overcoming the fear of falling to regain confidence. Fear of falling can ironically increase the risk of falls. When people become overly cautious, they may move stiffly or avoid certain activities, leading to muscle deconditioning and reduced mobility. Taking a fall prevention class or working with a physical therapist can help rebuild confidence and teach proper movement techniques. Exercises that focus on balance, coordination, and stability can be reassuring and empowering. 9. Improving foot sensitivity and footwear choices. The feet contain numerous nerve endings that provide sensory feedback to help maintain balance. However, conditions like diabetes can lead to reduced sensation, making it difficult to detect surface changes. To improve foot sensitivity, try walking barefoot when safe, particularly on varied textures like grass or sand. Rolling a tennis ball under the foot to stimulate nerve endings. Wearing well-fitted, supportive footwear with good grip and arch support. Avoid high heels, worn-out shoes, or loose-fitting slippers that could lead to missteps. 10. Correcting postural changes that affect balance. Poor posture can shift your center of gravity, increasing instability. Many older adults develop a forward-leaning posture due to muscle weakness or habits developed over time. A physical therapist can recommend posture-strengthening exercises, but simple habits, such as checking your posture regularly, practicing standing tall, and engaging in core-strengthening workouts, can make a big difference. 11. Stimulating cognitive function for better coordination. Cognitive decline affects reaction time, decision-making, and coordination, factors that contribute to falls. Engaging in mentally stimulating activities, learning new skills, and staying socially active can all help keep the brain sharp. Interestingly, dancing has been found to be particularly beneficial for older adults because it combines physical movement, rhythm, memory, and social interaction, all of which improve balance and cognitive function. 12. Making your home a safer environment. Even with strong muscles and good balance, hazards in the home can still increase the risk of falling. To reduce risks, remove tripping hazards such as loose rugs, clutter, or exposed cords. Install grab bars in the bathroom and handrails on both sides of staircases. Ensure adequate lighting, especially in hallways, stairs, and areas where you might walk at night. 13. Incorporating balance training into daily life. The best way to improve balance is to practice it consistently. Instead of setting aside a specific workout time, incorporate balance exercises into daily activities. Stand on one foot while brushing your teeth. Walk heel to toe while talking on the phone. Practice sit-to-stand movements during commercial breaks when watching TV. Maintaining balance as we age is not just about preventing falls. It's about preserving independence, confidence, and the ability to engage fully in life. Whether it's playing with grandchildren, traveling, dancing, or simply walking safely around your home, balance is key to a vibrant and active lifestyle. If you've noticed changes in your stability, don't wait. Start implementing these strategies today. Talk to your doctor about any health conditions or medications that might be affecting your balance. Stay active, and take proactive steps to make your home safer. If this video helped you, give it a thumbs up and share it with others who may benefit. Let's keep the conversation going. Drop a comment below if you have personal experiences or additional tips on maintaining balance. Don't forget to subscribe for more health tips and check out our recommended videos next. Stay safe, stay strong, and keep moving.